And actually, we have some specific treatment method named crosstalk technology. Crosstalk protocol has two countermeasures. First one is closely hyaluronic acid. It is a skin beep. And the second one is Sofwave. This is preconditioning of the skin. After we checked the recovery of the skin.
大家好，我是皮肤科林政贤医师，和你一起闲聊皮肤。那我们现在所在的位置呢，是在日本的横滨 Tears Grace Clinic。那在我旁边的这一位呢是 Dr. Oku Kentaro Oku。他是很有名的国际级的讲师哈。那他本身是皮肤科医师啦哈，他针剂的治疗啦，还有一些电音波啊都很有经验哈。那我们今天来这边参访的最主要目的呢，是因为他最近发表了一篇论文，是有关于肝斑用这个索夫波来治疗的论文，那是非常有创意哈。因为我们以前肝斑介绍很多，我们用矽谷电波啦，用雷射来治疗等等，把这个以前用来紧实拉提的这个索夫波 Sofwave 呢，用来治疗 melasma 肝斑。那我们今天要来请教他为什么会想到这些治疗方法，以及他的参数设定，还有哪些人适合。
Hi everyone, nice to meet you. I'm Dr. Kentaro Oku, and I'm a Japanese dermatologist. And my specialty is using energy-based devices like laser, RF, and ultrasound like Sofwave.
Congratulations to your newly published paper.
Thank you.
We also show your paper on our Facebook. I have some questions for you today.
Yes.
First of all, I want to ask, what your thinking point to start the treatment for melasma with Sofwave?
Yes. I think for the past 3 or 4 decades, we think the melasma as a pigmentary disorder. But in recent years, we have noticed it is not a pigmentary disorder at all. Actually, it's damaged skin. It's the reason of the damaged skin or the senescent skin. Yes, that is why I can treat the melasma for treating the damaged skin to recover the energized state. With Sofwave. That's a starting point.
But many patients think that there is a lot of heat by the Sofwave, by the monopolar RF. Are you afraid of the high energy to worsen the melasma in the beginning?
Yes. Actually, I did not have concern about using heat to melasma. Yes. Of course, if I use monopolar RF in higher energy, it's not good. The using Sofwave is some kind of tricky part. Of course, Sofwave is a ultrasound technology. And heating core, it is most energized zone will be located in the 1.5 millimeter depth. It's composed with collagen mainly, but my target is fibroblast located in here. It's called the papillary dermis in the shallower layer of the dermis. We have so many fibroblasts in the papillary dermis, and this is very damaged. It's weaker state. But if we apply the heat in appropriate heat, it's like taking a bath. The fibroblast will be energized. Once fibroblast is energized, this effect or affection will spread. Because fibroblast, it's like a command center. Fibroblast to melanocyte, fibroblast to keratinocyte, fibroblast to macrophages. Yes, these
maybe to the vasculature.
Yes, this regulation effect is very good to sedate the production of melanocyte from the melanocyte. That is why I want to focus in on the fibroblast, not to kill them, but energize them.
Energize. So in this aspect, do you think that such as Athera,
yes,
is it still effective for melasma because they also have the superficial 1.5?
Definitely, the huge difference between HIFU and Sofwave is HIFU create a coagulation zone. It means burn. But the Sofwave will not create the burn. This is simply adding the heat. But this heat from HIFU was so extensive. Yes, that is why we can coagulate the collagen fibers. But what I want to do is not the coagulate, but applying the heat, just applying and just energizing the cell. This is completely different. If you want to use a HIFU to treat melasma, you need to keep moving like this, like this.
We all know that there are many factors to contribute to melasma. So do you use combination therapy for melasma?
Yes, of course. Because using substrate technique with Sofwave is very effective. But we know it's not perfect. So I want, and the patient want more and more result. So I will use the close-linked hyaluronic acid injection. Yes, like a skin booster.
Another paper.
Yes, you're right. And using the laser, of course, Alexander laser to reduce the pigment in a very direct way.
So do you combine the microneedle RF?
Yes, sometimes.
I remember you have Sofwave.
Yes.
Okay.
Yes.
And also the Cispera.
Yep.
What your combination and recommendation with the three weapons, Sofwave, Cispera, and also the Sofwave?
And actually, we have some specific treatment method named crosstalk technology. Crosstalk protocol has two countermeasures. First one is closing hyaluronic acid. It is a skin beep.
Yeah.
And the second one is Sofwave. This is preconditioning of the skin.
Yeah.
After we check the recovery of the skin,
Yeah.
I will apply the picosecond Alexander laser to remove the pigment directly. And I need to reduce the inflammation. Yes, low-grade chronic inflammation as much as we can. That is why I will prescribe the isobionic amide. It means the Cispera agenase, yes, or some low-grade retinol. Yes.
Which one is first?
The Sofwave first. Yes.
Followed by the
hyaluronic
acid.
Yes. One session at the same time.
Yeah.
And we keep in 8 weeks apart. And then after that, I will consider to use the laser.
How about your recommendation for the patient's daily care?
I think this is a very important part or the primary part of the treating melasma. So using the sunscreen, of course, and not scrub. And using not the pigment agent, a brightening agent, yes. But I think the Cispera sensitive is very good. But if the patient has a very, very sensitive skin, using the high-density tranexamic acid is very good. Not the injection, the topical.
So we learned a lot of secrets from Dr. Oku. So thank you so very much.
Thank you.
Your very beautiful clinic.
Thank you. Thank you so much.
拜拜。
Bye.
那以上呢就是我们今天参访 Here's Grace 这家诊所啊 ，Dr. Oku 他给我们的介绍，其实还蛮丰富的诶。因为虽然我们已经打索夫很长的一段时间，但是其实他刚刚在示范的时候，又有很多的细节，包括你移动的距离、移动的速度，还有能量设定这些参数的变化，都会影响第一个是效果，第二个是病人的痛感。所以这次学到还蛮多的。那另外就是说，对于肝斑治疗的一些观念，当然我们以前讲过，肝斑是一个多因素的嘛。那以前我们用矽谷电波，还有一些美白的产品像 Cispera 用很多，但现在发现说索夫波也可以治疗。那索夫波我们目前可能也会针对一些比较难产的肝斑的患者开始试用看看，如果效果不错的话，因为之后会推广给更多的肝斑患者使用。希望今天的采访记录大家会喜欢，我们下次见喽，拜拜。那个叫做什么？